Hello students, welcome to Angel Health Academy. Topic for the day is Major Health Committees in India or Planning Committees in India Part 1. Major Health Committees or Planning Committees in India. I have been already uploaded one video that is Major Health Committees and their reports. In that I have been explained almost all those committees, but this video is only focusing on the exam point of view. Here I would like to talk about especially the Major Health Committees in India. So this topic will be one of the significant and most important topic in community health nursing, and it may ask even essay that is major health committees in India, or it may ask special committees as a short note. So this video is clearly on the exam point of view, or it focus on the exam, and in this I would like to talk about major health committees with mnemonic and easy tips. So let us move to the class, that is major health committees in India. So introduction. Health planning is an integral part of national socio-economic planning of the country. So health planning. In the previous video, in 5-year plan also we discussed what is health planning. So health planning is very crucial and very important step in the planning of health program in the country. So health planning is an integral part of national socio-economic planning of the country in total. The guidelines for this health planning or national health planning and organizing various healthcare delivery services and health system in the country were provided by a number of health committees or planning committees. So the guidelines for health planning in India or for the national health planning and organization of various healthcare services to the citizen in India were provided by a number of health committees or planning committees. So these health committees, major health committees, also known as planning committees. So in short, health planning is an integral part of national development for national socio-economic planning of any country. In India, the guideline for health planning or national health planning were given by a number of committees. Those committees were known as health committees or planning committees. Thus, Government of India from time to time appointed many committees, several committees to study the then existing health situation of the country. So study then existing health situation, health condition of country in the context of certain specific subjects. So Government of India from time to time appointed several committees to study the then existing health situation in the different subjects or topic of the country and to report in recommendation to improve the health services of the country. So those committees at the end of their survey and study, they have to give a report with a certain recommendation to improve the health services of the country or the nation. So that means so far Government of India implementing many health services or healthcare services to the citizen or to the public based on the recommendation were given by several committees, those who are appointed by Government of India. So next is major health committees in India. Major health committees. So there are mainly or major 8 committees and we have many other notable committees. So the major health committees or planning committees in India include first is Bohr Committee, BHORE, Dr. Joseph Bohr Committee, then Mudaliar Committee, then Chada Committee or Chada Committee, Mukherjee Committee, Jangalwala Committee, Kartar Singh Committee, Srivastava Committee and Bajaj Committee. And we have many other notable committees. So these were the important health committees or planning committees who were given recommendation to national health planning and implementing various healthcare delivery services in India to the citizen or to the public. So this list is made as a chronological order and who were the first committee and who were the last committee according to their period of time of appointment and submission of report. So you have to remember the committee according to this chronological order because it is written according to the period of their study and the report submissions. So if you feel very difficult due to follow or remember this particular committee names in chronological order, I have been made one small mnemonic and with that mnemonic you can understand the committees. So let us go through what is the mnemonic of list of major health committees in India. So this mnemonic I have made only for the exam purpose to remember the committees, major health committees or planning committees in a chronological order. So that I made like Bermudas. You know that what is Bermudas. Okay. So Bermudas is nothing but it is a shorts. Okay. Long shorts. So Bermudas Chacha, Mukherjee, in jungle, practice karate with Sri Bajaj. Now you can see that here is my imaginary that Bermuda's Chacha Mukherjee. So his name is Bermuda Chacha Mukherjee. Okay, you please understand according that. So this is Bermuda's Chacha Mukherjee is in jungle practicing karate. So he is practicing karate with Sri Bajaj. So this could be Sri Bajaj. So our mnemonic is Bermuda's Chacha Mukherjee in jungle practice karate with Sri Bajaj. So this Bermudas I have been underlined. That means it is I have made for the mnemonic like a two word bar plus mudas. So bar stands for Boer Committee. So you know that first committee is a Boer Committee, Joseph Boer Committee. So bar stands for Boer Committee, Mudas stands for Mudaliar Committee, and Chacha stands for Chada Committee, Mukherjee stands for Mukherjee Committee, Jungle stands for Jangalwala Committee, Karate stands for Kartar Singh Committee, Sri stands for Srivastava Committee, and last Bajaj stands for Bajaj Committee. So mnemonic is Bermuda's Chacha Mukherjee in jungle practice karate with Sri Bajaj. Okay. So in this way you can remember the mnemonic as per the chronological order. You can write the list of major committees in your exam. So hope you will make easy to write your exam with this mnemonic. So now let us discuss one by one the list of the committees in detail. So when you write a committee or planning committee in your short notes, you have to include certain points. So that is, first one is you have to write introduction. In the introduction you have to mention the period of that particular committee. Then you have to write name of the chairman of the particular committee. Then other name of the committee. All the committees were given other name according to their objectives. So all the committee were given another name according to the objectives of that particular committee. Then they have a set of objectives and they have given report at the end of their year, the period. So report of submission is very easy because that would be the last year of that their period of appointment. Okay. Then you have to write recommendation. That is an important or most significant part of the sessions. Minimum 3 recommendations you have to write in detail and in depth. So in this video I have been explaining all the committees, major health committees with 3 recommendations with easy tips. So actually in this video I would like to discuss major health committees by comparing 3 committees with this or with the use of this table. But I will tell you how to write an individual committee if it is asked for a short note. So then you have to write a separate about the particular committee in detail. So first I would like to discuss about a separate committee, that is the Boer Committee. Then later I will come back and I will discuss with I will compare 3 committees together and I will explain the features of the 3 committees. Then later I will explain in detail about the recommendation of the different committees. So if it is asked for a short note, you have to write like this. For example, Boer Committee, the period is 1943 to 1946. So Boer Committee is the first committee Government of India appointed in 1943. So first is introduction about the Boer Committee. So the Government of India in 1943 appointed a committee under the chairmanship of Sir Joseph Boer. So this is a person, Sir Joseph Boer. So in all the committee introduction you have to make same introduction. That is Government of India in the particular year appointed a committee under the chairmanship of that particular committee chairman. So the name of all the committees are based on the chairman of that particular committee. Then you can write next other name. So each committee, every committee has another name. Okay, that also you have to remember. So other name of the Boer Committee is a Committee on Health Survey and Development Committee. So other name of the Boer Committee is Health Survey and Development Committee. I have been underlined development because we have the next committee, other name is Health Survey and Planning Committee. So you have to differentiate which is Development Committee, which is Planning Committee. So the first committee is the Boer Committee. So like that you can remember that a clue is that Government of India started to development the health centers and hospital in India. Because of that committee we are given another name like a Health Survey and Development Committee. So the Boer Committee is also known as Health Survey and Development Committee. That is a second feature or second heading. And third heading is objectives. So each committee have a particular objective. So the objective of Boer Committee was to survey and report the existing positions regarding the health condition. That means health situation or health problem of the country. So to survey and report the existing position regarding health condition and health organization were available during that period in the country. So regarding health condition and health organization. Health organization is nothing but healthcare agencies, okay, health centers, hospitals, etc. So to survey and report the existing positions regarding the health condition and health organization in the country was the objective of Boer committee. Then submission of report. I already mentioned that usually the report will be submitted at the end of their period. So here 1943, 1946 means the committee submitted, the Boer committee submitted its report in 1946. Then next is the fifth feature is the recommendation of the Boer committee. So the most important three recommendations in this video, all the committees I have been only selected three important recommendations to answer the examination. To write the answer for the examination, you can remember only three. Then you can have a comparison. Otherwise, you will have a good confusion between the committees and their recommendations. So the recommendations of Boer committee includes the three most important recommendations. First one is integration of preventive and curative services. So integrating preventive services and curative services. That means preventive services comes under health care and curative services comes under medical care. So integration of medical care and health care. So the Boer committee recommended integration of preventive and curative services. Second recommendation about the development of health centers and hospital in the country. So development of health centers and hospital. So we already know that this committee is also known as health survey and development. This is the clue. You can remember the other name of that Boer committee, that is development committee. So development of health centers and hospitals. And last one is preparation of social positions. Preparation of social positions. So these were the three important recommendations, and I will be discussing later in detail about this particular recommendation. Now we would like to compare all the committees' general features, and at the last I will discuss the recommendations of each committee. So you can use this table and you can compare three committees together, and easily you can study and you can write for the examination if it is for a essay question. Okay, otherwise only you have to write separately a particular committee, as I have been already shown in the previous sessions. Okay, so now Boer committee, Mudaliar committee, Chada committee. So first committee were Boer committee, second is Mudaliar committee, and third one is Chada committee as per the chronological order. The first feature is period. So you already know that I have been already explained that the period of Boer committee were 1943 to 1946. Okay, then second committee, Mudaliar committee, the period were 1959 to 1962. Now you can feel that there is a gap between 1946 and 59. But there are many other committees also government is appointed between this period that will be discussed later as a list, that is other notable committees. But I am not going to explain those committees. In my previous video, health committees and reports, I had been explained all those committees. Okay, here this is only exam point of view and exam focused video. So I am going to discuss only major committees. So that's what the difference or gap between the period. So second one is Mudaliar committee. So the government of India appointed another committee under the chairmanship of Dr. A.L. Mudaliar in 1959. Like that you can give an introduction. So the period is 1959 to 1962. Then Chada committee the very next year, that is the period is 1963. So now here you can see that 3 years duration. So here also 3 years duration, but in Chada committee were appointed only for 1 year. Okay, that is 1963. That means they were given the report at the end of that year, that is 1963 only. Okay. Now, next second feature is about chairman. So, Boer committee we already know under the chairmanship of Sir Joseph Boer. Then in Mudaliar committee it is under the chairmanship of Dr. A.L. Mudaliar, Lakshmana Swami Mudaliar, A. Lakshmana Swami Mudaliar. Okay, Dr. A.L. Mudaliar. Then about Chada committee, the chairman was Dr. M.S. Chada, Dr. M.S. Chada. So that is about the chairman of these three committees. Then other name of the committee, I already mentioned the Boer committee is also known as Health Survey and Development Committee. Then you see that next Mudaliar committee, okay, Health Survey and Planning Committee. After developing health center, primary health center and all, government is started to plan health services. Like that you can remember a clue, okay. So it is Health Survey and Planning Committee. So Mudaliar committee is otherwise known as Health Survey and Planning Committee. Then next is Chada committee. Chada committee is introduced with a particular, a specific objective, that is Because of that, the committee is known as Committee for Maintenance Phase of Malaria Eradication Program. So here the Chadha Committee is appointed in 1963 with the objectives of something related to malaria. So you can remember Chadha Committee is related to malaria. So the committee is otherwise known as Committee for Maintenance Phase of Malaria Eradication Program. Then objectives. So objectives of Board Committee already we have discussed, that was to survey and report the existing health condition and health organization available in the country and their positions. But in Mudaliar Committee, the objective was to survey and report the health needs and resources in the context of 5-year plan. So you already know that 5-year plan was started in India in 1951. 51 to 56, then 56 to 61. Now it is already 59. That means the second 5-year plan is going on. So that's what the objective were, to survey and report the health needs and resources available in the country in the context of 5-year plan, whether they can achieve the target according to the resources available in the committee. For that, this committee has to make a survey and give a report. The second objectives of Mudaliar Committee were to review the progress which is made by the Board Committee recommendations. So as you know that it is a second committee. Already Board Committee were given report. Okay, government has been changed or implemented somehow the recommendations. So to review the progress of the Board Committee recommendation or after the implementation of certain program by the government. So to survey and give a report in relation to progress of the Board Committee recommendations. Then next is Chadha Committee. Objectives of Chadha Committee to survey and report the arrangement necessary for the maintenance phase of National Malaria Eradication Program. So I already mentioned that Chadha Committee is mainly focused, or it is a specific committee for malaria. Okay. So the objective was to survey and report the arrangement necessary for the maintenance phase. So government has to make certain arrangements to prevent the outbreak. So some arrangements are necessary, though they have to survey and report regarding the arrangement, whether it has been done or not done and what else has to be done, like that. So to survey and report the arrangement necessary for the maintenance phase of the National Malaria Eradication Program. Now the fifth feature is the report submission. So report submission, as you know that at the end of the particular period of that particular committee. So Board Committee, it was 1946. So Board Committee were given report in 1946 with certain recommendations. Then Mudaliar Committee were given the report in 1962. That is the end of their period. Okay, 1962. And Chadha Committee were appointed only 1 year, that is 1963. So they were given at the end of that particular year during 1963. Next, sixth feature is the recommendations. So I have said we have selected the most important 3 recommendations. So at the end of discussing all these committees general features, in the last I will be explaining in detail about these 3 important recommendations with the mnemonic or with the easy tips. Okay. So Board Committee we already discussed. Then Mudaliar Committee. So Mudaliar Committee also had 3 important recommendations, that is regional services. First recommendation was regarding regional services in the country. Second recommendation was regarding regional organization. So development of regional organization in the country. And last one is All India Health Services. So render the health services in all the states of the country in a uniform pattern, that is All India Health Services. So this also will be discussed later. And Chadha Committee also were given 3 important recommendation, that was setting up of primary health unit in India, setting up of primary health units, then appointment of basic health workers in the areas of malaria maintenance area, that is appointment of basic health workers, and last one is appointment of family planning health assistant to maintain the family planning services. So appointment of family planning health assistant. So will be discussed later in detail. Now we'll compare to the next committees. So the fourth committee was Mukherjee Committee. Period 1965 to 66. So Government of India appointed another committee under the chairmanship of Sri B. Mukherjee. Sri B. Mukherjee was the chairman. Okay. So immediately followed by Mukherjee Committee, Government of India appointed another committee under the chairmanship of Dr. N. Jangalwala. Dr. N. Jangalwala, that is Jangalwala Committee. Then Kartar Singh Committee. The duration is 1972 to 73. 1972 to 73. Kartar Singh Committee. So Government of India appointed another committee under the chairmanship of Sri Kartar Singh in 1972. Okay. That is about the period and the chairman of these three committees, Mukherjee Committee, Jhangalwala Committee and Kartar Singh Committee. Other name of the committees. So Mukherjee Committee was also known as Review Committee for Family Planning. So before we said the Health Survey and Development Committee, that is BOR Committee, Health Survey and Planning Committee, that is Mudaliar Committee, then Committee on Maintenance Phase of Malaria Control, that is the Chada Committee. Now fourth committee is Mukherjee Committee, another one area that is in the area of family planning. Okay, this committee only belongs to family planning. So this committee was known as Review Committee for Family Planning. Then Jhangalwala Committee is also known as a Committee on Integration of Health Services. So we had seen that in the BOR Committee recommendation, first recommendation was integration, but that integration was between health care and medical care. Okay, here integration in the health services only. Okay, integrating the health services. So that is integration of health services. Then Kartar Singh Committee was also known as a Committee on Multi-Purpose Workers. So this committee is specifically appointed for something regarding planning about the health workers. That is multi-purpose workers. So Kartar Singh Committee also known as a Committee on Multi-Purpose Workers. So this is one of the important feature of the committee, that is the other name of the committee. So you have to remember the other name of each committee or specific name of each committee. Next is objectives. So Mukherjee Committee objective was to check the result of malaria vigilance operation, because that previous committee was related to the malaria maintenance accord, Chada Committee. So the Mukherjee Committee objective was to check the result of the malaria vigilance operation. Then objective of Jhangalwala Committee was to examine the urgency of integration, whether integration is needed, whether it is feasible. Okay, so the objective of Jhangalwala Committee was to examine the urgency of integration, that is integration of health services. Then objective of Kartar Singh Committee was to study and make a structure of integrated services. Already in importance of integration and urgency of integration were done in the report or in the recommendation by Jhangalwala Committee, followed by only Kartar Singh Committee came during 1972. So the objective was to study and make a structure, a pattern, okay, in the practical sense, a structure of integrated services in the primary health center or in the public health center, etc. So to study and make the structure of integrated health services, that was the objective of Kartar Singh. So the fifth feature is report submission. Mukherjee Committee were given the report during 1966, that is end of their period. So the committee were given the report in 1966. Then Jhangalwala Committee were given in 1967 and Kartar Singh Committee were given 1973 at the end of their period, that is 1972 to 73. Now let us see the recommendations. Now recommendations of Mukherjee Committee. So first recommendation was separate staff for family planning. As you know that Mukherjee Committee directly belongs to the family planning services. So they recommended a separate staff for family planning, first recommendation. Second, de-link the malaria activities from family planning activities. So during that period, the health worker were done both malaria activities and family planning activities together. So this committee recommended to de-link, to separate the malaria activities from family planning activities. Then for that separate staff, they recommended to appointment the different health personnel or different health workers. So separate staff for family planning, dealing the malaria activities from family planning, and appointment of a set of health personnel or health workers. Then recommendations of the Jhangalwala Committee were, first one is integration of health services, that is integrated health services. Second recommendation is different, that is equal pay for equal work, that is equal pay for equal work. Okay. And the last recommendation were no private practice by government doctors. So Jhangalwala Committee recommended the government doctors should not do the private practice because they want to maintain the quality of the services in the government sector for the public. So no private practice by government doctors. Then three recommendations of the Kartar Singh Committee were, one is they announced the program for multi-purpose health workers, because this committee belongs for multi-purpose workers. So they mentioned, they explained, they developed a program for the multi-purpose health workers. Then second, they were given recommendation about the staff and population coverage of the sub-center. Staff and population coverage of the sub-center under multi-purpose health worker scheme. Then third one is appointment of various health personnel such as female health supervisor and qualified public health nurse. So this Kartar Singh committee recommended in the last recommendation was appointment of female health supervisor and qualified public health nurse. So we'll discuss in detail later all these recommendations separately. Okay. Next is Srivastava committee and Bajaj committee. So comparison between Srivastava committee and Bajaj committee. So the period of Srivastava committee were 1974 to 1975. Bajaj committee were 1986 to 1987. So Government of India appointed another committee under the chairmanship of Sri K.N. Srivastava in 1974. So the chairman for the committee, Srivastava committee, was Sri K.N. Srivastava. K.N. Srivastava. The Bajaj committee chairman was Professor J.S. Bajaj. Professor J.S. Bajaj. He was the professor of AIIMS New Delhi. Okay, Professor J.S. Bajaj. Then other name of the Srivastava committee was Committee on Medical Education and Support Manpower. So they were given important about the medical education of the health workers. Support manpower is nothing but we are creating some of the para-professionals or semi-professionals from the community itself. They called the support manpower for the rural health services. So the committee introduced the rural health services. So under the support manpower. So the Committee on Medical Education and Support Manpower. Then the Bajaj committee was also known as Committee on Health Manpower Planning, Production and Management. That means identifying the various health manpower, health personnel to render the health services, and planning of the health personnel. Production means recruitment of the health personnel, and maintaining the health personnel in the field, that is management. So Committee on Health Manpower Planning, Production and Management. So these two committees are entirely different from the previous committee. These Srivastava committees are related to or based on the medical education and support manpower, and Bajaj committee is related to Committee on Health Manpower Planning, Production and Management. So you can remember easily. The objective of Srivastava committee was to devise the suitable curriculum, to prepare the curriculum for the medical education. So to study and devise the suitable curriculum and suggest or recommend the steps in medical education for the improvement of the quality medical education. To devise the suitable curriculum and suggest or recommend various steps for the medical education in the country. Okay. The objective of Bajaj committee was same, that is to plan to recruit the various health personnel in the country to render the quality community services or health services. To plan and recruit the health personnel in the country was the objectives. That means finding out the requirement of the health manpower or health personnel in the country and recruit the health personnel according to the need. Last feature is submission of report. So Srivastava committee given report at the end of their period, that is 1975. Then Bajaj committee 1987. Now the recommendations. So the three important recommendations of the Srivastava committee were, first one is organization of rural health services. So the training program for the support manpower will come under rural health services. So organization of the rural health services was the first recommendation of the Srivastava committee. Second one is establishment of two types of health workers, two cadres of health workers. So two group of health workers establishment. Then establishment of the medical and health education commission. So establishment of the medical and health education commission to make new reforms. Okay, establishment of medical and health education commission for the reforms of the medical and health education in India. Then three important recommendations of the Bajaj committee. First one is utilization of Indian system of medicines, that is indigenous system of medicines or AYUSH in the national health programs. Then develop continuing education program for all the health personnel in India by the health agency. So to enhance or improve or develop the quality of the health workers, develop continuing education program for all the health personnel by the health agency or health sectors. So that was the second recommendation of Bajaj committee. Then third recommendation of Bajaj committee was determine health manpower requirement in the nursing field. So determine health manpower requirement for nursing personnel and recruit, okay, and fulfill that the vacancy. Okay, so these were the three recommendations of Bajaj committee. Okay, then we have so many other notable committees. In the beginning session I already mentioned, and in my previous video I have been explained all these committees So in that video, I have been explained in detail about this particular committees. So you know that first committee was the Joseph Bohr Committee, 1943 to 1946. But second committee, Mudaliar Committee, came at 1959 to 66. So I said in between there are many committees. So there were many committees appointed by Government of India, but that was not so important. That's what we are not discussing. We are discussing only the major committees in this video. So Chopra Committee 1946, Soke Committee 1947, Shetty Committee 1954, okay, Shetty Committee 1954, Mehta Committee 1957. There were two Mehta committees, that is 1957 and 1983, but these were different committees. Then fifth one is Renuga Rai Committee 1960. That is Renuga Rai Committee, then Jain Committee 1966, Krishnan Committee 1982 and Mehta Committee 1983. So these were the other notable committees who studied the situations and health condition and with the different objectives and recommended for the development of the health services and health planning in India. So other notable committee includes Chopra Committee, Soke Committee, Shetty Committee, Mehta Committee, Renuga Rai Committee, Jain Committee, Krishnan Committee and Mehta Committee. Okay. So now let us talk about in detail about the recommendation of all the major committees. Now the last section, that is recommendations of major health committees in India. So you have to learn in detail about the various recommendations of different committees, because a particular committee may be asked for a short note. So you may have confusion about the recommendation because you are studying many committees with 3 recommendations. So we have to specific with that particular recommendation of that particular committee to write the examination. So here we can use the mnemonic or easy tips as a story creations. Okay. So it is only for the exam purpose. We are creating a story, and with that story we are learning the recommendations of all those committees. So the mnemonic what we are made the same. Bermuda's Chacha Mukherjee in jungle practice karate with Sri Bajaj. Now you know that we have a imaginary person. His name is Bermuda's Chacha Mukherjee, and he is actually at present in jungle. He is practicing karate with Sri Bajaj. This is we already discussed. Okay. Now we can create a story related to this Bermuda Chacha Mukherjee. Okay. So Government of India understood that this Bermuda's Chacha Mukherjee is practicing karate in jungle. Okay. And his family left alone. So government would like to plan the health services for both Bermuda's Chacha Mukherjee and his family. Okay, so that is the creation of story. So Government of India understood that Chacha Mukherjee is in the forest and his family is left alone. So both he and his family has to be cared. So it is the responsibility of the Government of India to render the various health services. Moreover, the government took a more interest and more keen interest in his family and his personal health, because he was the former an IPS officer, a retired IPS officer. Thus, Government of India appointed many committees to identify the health status and health needs of he and his family, then rendered comprehensive services to him and his family. Thus, Government of India appointed a committee, that was Bohr Committee, the first committee 1943 to 46, to conduct a survey and understand that Mukherjee health status and his family health status and make various recommendations to render the health services. So, based on that, Bohr Committee had conducted a survey and they given the report with set recommendations. So in that they mentioned the integration of health services for both Mukherjee and his families. Then second, development of health centers and hospitals to render the health services or comprehensive primary health care services to him and his family. So the Board Committee recommended to develop the primary health units, primary health center and sub-center. Then secondary health unit, that is community health center. Then development of the hospital, okay, like primary, secondary and tertiary level of hospital and district hospital. Then later Government of India appointed another committee, that is Mudaliar Committee. So the Mudaliar committees had found not only his family but also a group of people, other family, those residing in the region also need a good comprehensive health services or secondary and tertiary health services. So they recommended to start the regional health services by strengthening the district hospital to render the tertiary care services through setting up of regional organizations, okay, such as medical college regional organization between the 2 or 3 districts, and to render all India health services, that is in the same pattern health services, not only for this particular region but also all the regions of the state. For rest of the other people also required a particular quality and comprehensive healthcare services. Then Government of India appointed the third committee, that was Chada Committee. Okay, Chada Committee could find that as Bermuda's Chacha Mukherjee in the jungle, there was a number of or plenty of mosquitoes. Okay, so the Mukherjee may be prone to get malaria, so it has to be prevented. For that, they recommended to start the primary health units with specific staffs like a basic health worker and family planning health assistant to render the services to prevent and control the malaria or prevent the spread of the malaria. So later government also understood that the Chachaji or Chacha Mukherjee in the jungle, so his family is left alone and there is no person to take care of his family and family has to be planned. Then moreover, he was very sad because of his daughter. His daughter is studying in MBBS. So he was very worried about her studies because he is in jungle and he is practicing karate. So he requested government to render some special services with special people in relation to family planning and family welfare services to his family. So because of the Chacha in jungle, he has become very sad. So Government of India appointed another committee to find out his condition and his family condition and to report with a certain recommendation. So Mukherjee committee recommended a separate staff is required for family planning to take care of his family, because the previous committee recommended that basic health worker has to do the same work like they have to take care of this Mukherjee at jungle. At the same time, they have to give the services to the family. So family is away from Mukherjee. So this staff felt difficulty to give or to serve both Mukherjee and his family. Thus, Mukherjee committee in their recommendation, they mentioned that there should be separate staff for family planning and malaria activities must be done or that has to be dealing from the family planning services. Then later Government of India appointed another committee, that is Jangalwala Committee. So in their report, they recommended to integrate the health services. So in the health services itself, it has to be integrated. Then there should be a unified cadre, a group of personnel, unified personnel and unified approach for all the problems. Now in the previous recommendation, it is said that malaria activities are done by some other staff, a few staffs. Then family planning services has to be done by separate staff like that. But the Jangalwala Committee recommended there should be one group of staff that is called a unified cadre. They have to render all the services. So during this situation, the staff had a difficulty to do the services in both sides. So they started to ask for more salaries. Then they claimed that community health work is also a work. It need more pay because we have to do both services like that. So he recommended equal pay for equal work and special pay for special work. So those who are rendering services in the forest, those who are rendering the services in the living area, also the services are different, but their pay is almost the same by the government. So they asked for their pay. Because of that, the committee was recommended about the equal pay for the equal work and special pay for the special work. Then committee also stressed that no private practice by the government doctor, because in the government sector, they have to give more quality services to the his family and the rest of the people in the country. Then later Government of India appointed Kartar Singh committees, and Kartar Singh committee also recommended to appoint that a particular group of staff that is called multi-purpose workers, both in rural area and health centers. So the multi-purpose workers can work both in the rural area, that is in the forest area, to take care of the Mukherjee, and in the other area where the health center is established, okay, where the health center is present. So those people also get the services. So Kartar Singh committee recommended appointment of multi-purpose health worker. So they work, single health worker will work multi-purposes, so different purposes than the uni-purpose workers. So there were two categories, that is multi-purpose workers and uni-purpose workers. Uni-purpose workers concentrate only single work, like vaccinator, they do only vaccination, okay. So multi-purpose worker do both vaccinations, RC services, family health services, general health services, etc., etc. So appointment of multi-purpose workers were the recommendation of the Kartar Singh committee. The later Government of India appointed another committee with the name of Srivastava, that is Srivastava committee. This committee, that is Srivastava committee, could find that Mukherjee families in residing in the rural area. Thus, the organization of rural health services has to be done. So they recommended, in their recommendation, first recommendation was organization of rural health services with two type of staffs, two type of cadres. So Srivastava committee recommended a first recommendation regarding the organization of rural health services as Mukherjee's families residing in the rural area. So in the second recommendation, Srivastava committee mentioned about the two cadres of health worker. The community worker should be trained from community itself, and they were given a particular period of training and they were used as a community worker. So in the second recommendation, like a support manpower, that Srivastava committee recommended that people would be selected from the same village or rural area, and they have to given a training, and they have to name it as a community worker, and they have to utilize for the health services, that is to connect the community people to the medical officer through the health worker. So the two criteria were, one is community worker, those people who selected from the particular village or community or rural area and given training, and sub-center staff, that is health worker male and health worker female, to the medical officer to render the quality comprehensive services to the particular rural area or the village. Then Srivastava committee also found during their survey the daughter of Mukherjee is studying in MBBS. So they were given importance into establish a medical and health education commission to reform the medical education in the country. In other way, the government were more conscious about the study of the Chacha Mukherjee's daughter, because she is doing MBBS. That's what the government wants to make some reforms, changes in the medical education to improve the quality of the medical education in the country. Thus, Srivastava committee also recommended to establish a medical education and health education commission to reform the medical education in the country. Then last, the government of India appointed another committee under the chairmanship of Professor Bajaj, that is Bajaj committee. So this committee is also known as Manpower Planning Production Management Committee. So their main focus regarding manpower management in the country, that is health personnel management to render the comprehensive services. So Bajaj committee understood that not only the Mukherjee and his family, but also all the people in the country or citizen or the public in the country has to get the services, quality and comprehensive primary health care services and other healthcare services, that is medical and healthcare services. So he recommended about the utilization of the Indian system of medicines or indigenous system of medicines in the national health program or the basic health services. Then he also recommended to determine the adequacy of the nursing staff required to render the nursing services in the country and to recruit the number as per it is or as much as it is required. Then last, he recommended about the continuing education for and continuing medical education for all the health personnel in the country by the health agency to improve the quality of services, not only for the Mukherjee and his family, not only for the Mukherjee and family, but also for all the people and all the families, all the public, all the cities are residing in the country. So this is about the story I have made to understand the various recommendations of the various committee. With this story, you can study in detail about the three specific recommendations of the committee, and you can write for the exam. So far we have discussed about the features of all major health committees and planning health committees in India with mnemonics and easy tips with story regarding the recommendations. So in the second video and the second part, I will explain in detail about the recommendations of this major committee in detail by applying same creative story. And so please don't forget to see the second part of the video. So hope this video really benefits in your studies, and if you feel it is really worth and benefit, please like, share and subscribe my channel. Stay tuned with the Angel Health Academy for the second part of the video recommendations of these major committees and planning committees in India. Thank you.